Hey everyone, what's up? It's Dr. Charlie PT here. I wanted to share a quick video and a little bit of a snippet from a coaching call I had with a woman who basically was told that arthritis was the cause of her back pain and or at least a portion of it. And so I help her sort of debunk this because as you'll learn, probably not true, all right? And so I help her debunk this sort of myth of arthritis causing back pain and or at least her pain and share with you my opinions about it, help her move beyond that into more of a solution-oriented sort of mindset versus focusing on the problem, and also share what the evidence suggests about arthritis as the cause of back pain, all right? So if you're not sure, by the way, as to the cause of your pain, you can check out my DIY diagnostic guide. Basically, I lay out my complete sort of thought process and diagnostic algorithm as to how I figure out the most likely source of symptoms for folks with back, butt, and sciatica problems. So let's check out this snippet of the coaching call, and then I'll share with you what evidence suggests as it relates to arthritis and back pain right after the coaching call.
And then, because I do have arthritis, so what do you think about motions and arthritis or pills and arthritis? Like, should I take my pills? Should I work on the motions? Like, or should I do both? How do you feel
Question.
about medication?
Yeah, yeah. I don't have much of a feeling other than I don't understand why we're trying to change something that happens naturally,
Okay.
right? I'm not saying you can't. I'm just saying there's lots of stuff out there, right? There's glucosamine, chondroitins, osteobiflex, this, that, right? We've done some. I did some supplementary or some additional research on some of that stuff at USC. I mean, we don't really have anything other than from the manufacturers, of course, right? That say like really works well and is proven, right? And the krill oil, the this, that, right? It does this for. I mean, we have actually some evidence with fish oil and for health, cardiovascular health, omega-3s and whatever, but that's nothing special to fish oil. That's just like you can get that from actually eating a fish. We've known this for a long time, right? And so it's just the convenience of it, right? So at the end of the day, you want to think of it like this. A lot of these changes that you're going to find in people of your age, you're not old. How old are you?
47.
47. No, but the idea, right? Like when we look at the evidence, it's like we see arthritis start as early as like 30 years old in lots of people. Okay. Maybe like 30 years old, right? That was like 17 years ago. So now it must be really bad, right? But like we also see like little to no correlation between arthritis and pain.
Yeah. Okay.
Meaning, like think of it like this. A lot of what people are led to believe are like these bad things that are happening in their body
Mhm.
are just normal things that happen in everybody and they don't have to be a problem necessarily, right? And so it's like as you get a little bit older, you might start to have wrinkles, like the crow's feet,
Yeah.
crow's feet, right? You're like, I don't like those things, right? Yeah, yeah. But like, does your face hurt? No, it doesn't hurt, right? Your hair, you maybe lose some of your hair, but like, does your head hurt? Right? And so it's interesting that we take things like wrinkles, like they are on the skin, but they're just in the body, wrinkles in the body. What freaks us out is we can't see them. At least we can see the crow's feet and we can like do stuff to them, right? But like inside, we're like, whoa. So we take all these high-tech images and highlight everything wrong with us, all the wrinkles inside. And then we just say, problem. What do you mean problem? I mean, like, it's a problem if you make it a problem. I
Yeah.
mean, but like, there are lots of people who are 47 and have arthritis and they don't take any meds for it. And they're playing tennis right now.
Yeah. Because I stopped taking them and I don't see a difference.
Yeah, I wouldn't expect you to see a difference. So I'd say, hey, if you're taking them again, I'm not like the med dude. That's not like in my scope of practice, but I'd be questioning whether or not you have to take them at all,
Yeah. Okay.
right? And motion wise, like one of the best things for arthritis is motion.
Mhm.
Arthritis is generally caused, right? Like true symptomatic arthritis. You have two surfaces. You start to stress out certain surfaces. You start to like put a lot of load through like things over and over again, just like if you have hands, right? Like calluses, blisters. I have a big blister right here, right? Because I was like doing a lot of stuff and like I put a lot of stress through one area of my body. And
Mhm.
so picture arthritis kind of like, I don't know, calluses. And so it's like, hey, you've got calluses in the spine, right? Because you've been loading certain things where it's not good or bad. And at the end of the day, it's like you want to bring nutrients and blood supply and lubrication, right, to that area. And how do
Mhm.
you do that? You move it.
Yeah.
Right? So how do you take knees that are painful and make them not painful? You work them,
Yeah.
right? And you build them up and you bring blood supply and you like stimulate the area. How do you take a woman who has osteoporosis and improve her overall bone strength and reduce fracture risk? You don't
Mhm.
do it overnight, but you have her pick up heavy things, which is the opposite of what they tell you to do.
Yes.
Run from things, be afraid because you could hurt yourself. What happens if you actually have to pick something up? Then you're really going to hurt yourself if you've never practiced it. So what you do is you stress out your bones in a progressive fashion, because there's something called Wolff's Law. Not that you care, I'm just a nerd. So like bones respond, or tissue responds in the direct, basically in proportion to the stress that you place upon it. So if you don't place stress on your tissues, it's like they're not going to change.
Yeah.
And so like you have brittle bones, and because they're brittle now, and you've been told they're brittle, right? You run away from doing things, but that's the exact opposite. You actually need to get on some type of program to actually stress your bones out so they are stimulated to then grow.
Yeah. Okay.
So movement is good for that. Lots of people have it. It might not feel any pain, right? So like just be mindful of like these labels that have been placed on you. They might be blocking a little bit.
Probably
You might just be able to like peel them off and throw them in the trash.
Okay.
Right? Because you definitely have arthritis. I mean, there's no question.
Yeah.
Right? Like I probably do too. I'm younger than you.
Yeah.
All right. But that's the idea. And so like you line up 147-year-old females who have done stuff with their body, right? Like you have lived life. And it's like, you're going to have something wrong with you.
Yeah.
But 75% aren't going to hurt and 25% are. How do you explain it? I don't know. We don't know. All right. So what are your thoughts on that? Was that new news to you, or was it not? Right? And does that help you understand the power of labels, right, as it relates to your aches and pains? So you're going to be told that something is the cause of your pain. Maybe it's arthritis, maybe it's an SI joint problem, maybe it's a disc problem, right? But is it or is it not, right? If all the things align, if all the stars align, it makes sense, perhaps, right? But at the end of the day, evidence suggests that there is very little to no correlation between what is found on imaging and the symptoms that people experience. And arthritis is no different, all right? And so there was actually a study that was done in 2022 out of the Journal of Spine, all right? Spine is like a really big journal as it relates to back pain treatment and just sort of, topics related to back problems. And what they did is they studied and followed 3,300 people. It's not very common. This is called a longitudinal study. So they took a baseline MRI, pain ratings, things like that. And then what they did is they followed 3,300 people over a 6-year time frame and then resurveyed those people to see what did the MRIs look like then and what was the pain experience of those people, right? Did their pain change? Did their pain not change? So some people had pain, some people didn't have pain in the very beginning, all right? Some people had arthritis, some people didn't have arthritis. But the study pointed out two very important things. Number one, that there was very little to no correlation between arthritis and the pain that people felt. That's number one. But the second thing, which is really cool, and something maybe that came up for you when you think about arthritis. Lots of people, when they are diagnosed with arthritis or degeneration, they think, man, this can only get worse. But is that true? Can it only get worse? And does it matter if it gets worse, right? So you think like, this crumbling cookie, it can only crumble more. This foundation, it's old, right? Like it's gonna get worse with time. Well, maybe, but does it matter? And so when they studied people, they took the baseline of the MRIs and the pain. And what they found is that the pain did not necessarily follow the findings of the image. Meaning, in some people, the MRI findings got a bit worse, but pain didn't necessarily get worse. In some people, the MRI findings didn't get worse. Yet maybe they hurt a lot more, right? And so just because you have arthritis now or degeneration now doesn't mean that later you're going to have more pain or even more arthritis per se, all right? So hopefully that puts you at ease. And the other thing, right, that I just want to summarize from this video, and I'll flash up that reference for you too, is that even though you're told you have arthritis, it sounds very scary, right? Things are eroding, things are degenerating, things are just getting old and crumbly, right? You want to think of arthritis as sort of just normal stuff, all right? Like calluses on your hand. And, if you have calluses on your hand or you have wrinkles in your face, do you see them as bad things? Right? Maybe the wrinkles. Let's talk about the calluses, all right? Do you see those as bad things? Do I think about my calluses all the time? Like, oh my gosh, my hands are getting old because I have calluses on my hands, right? Probably not. In fact, right, you might see them as protective, right? Maybe they allow you to grip the bar a little bit harder, right? If you're in weightlifting. Maybe if you're like my father-in-law and you crawl around on your hands and knees like a monkey, because you install hardwood floors all day, maybe they allow you to do that and they protect your knuckles because they've developed some thickness, all right? They've developed a little bit of resistance, right, to the environment. So the body is going to respond to stresses placed upon it. And that's just normal. It happens on the skin, happens on the face, happens on your head, happens all over the place, all right? And so at the end of the day, so if you change the way you think of things, instead of thinking of arthritis as this bad thing, think of it like a callus on the skin, it's actually protective, then that what you think of changes. Arthritis no longer becomes scary. So again, I'm not saying arthritis can't cause pain, but a lot of it is asymptomatic. I mean, it's just a part of normal life, right? And we're all going to get it at some point, develop it at some point, but it doesn't have to be a bad thing. All right, so hopefully this was helpful. Let me know your thoughts in the comment. Also be sure to hit the like and subscribe button as well as the bell for notifications when we go live every single week. Thanks so much, everyone. Chat soon.